Yo, yo.
Hi and welcome back to my next video. And it seems like I've been on a long break with my videos. And the reason for this long break is because Sumir underwent his second open heart surgery on the 19th of November 2020. And the reason that I'm here today is to share that journey with you, an open heart surgery and the CKD journey. Well, since I already mentioned that Sumir underwent two different surgeries, open heart surgeries, one in the year 2019, which was an aortic dissection type A. At that point of time, Sumir had no renal functions and was on dialysis. In 2020, he underwent a debranching surgery and was transplanted, which means he had his renal functions. It's extremely difficult to say which one of the two was more stressful. However, in this video, I'm going to be talking about the journey that I just experienced in the year 2020. And to make this video a little more easier, I'm going to break up the recovery period week by week. And the normal recovery period for an open heart surgery, like the first one was about 8 weeks, 6 to 8 weeks. But in the second open heart surgery, Sumin had a recovery period of 3 months to get back to complete normal life. But you'll actually realize between 6 to 8 weeks itself, your loved one will be able to resume most of the activities. So let's start off with the first week. Firstly, for me, the first week was the easiest because immediately after surgery, for about 3, sometimes 4 days, your loved one could be in the CCU depending on recovery. He or she will be moved to the room for another 2 to 3 days and only then be sent home. And for the first 1 week was easy for me because you're under the supervision of doctors and professional nurses. So all you have to do is watch what they're doing and learn. That's something really important you have to keep in mind. Some things that I've seen Sumit experiencing, obviously a fresh wound, new from surgery, a lot of disorientation, a lot of mental and emotional trauma, definitely a lot of fatigue. And since you're in hospital, it was easy to deal with. One thing that I'm going to tell you, if you're a caregiver, please ask a lot of questions during the 1 week that you're in hospital. While you'll still be given all information, don't feel bad to get all your information clarified because from week number 2, it only gets more intense. So let's move on to week number 2. On week number 2, you can definitely expect your loved one, if he's been on or she's been on a normal regular recovery. By week number 2, you should expect to be home. And like I mentioned, this is when it gets really difficult because you have no more doctors, no more nurses to help you with this journey, and you're completely on your own. So, what you could expect in week number 2. So, the first thing that I remember from week number 2 was pain. Pain management was extremely difficult. The patient had a lot of pain post surgery on the upper back, on the neck, which apparently is very normal for a person who undergoes an open heart surgery. For the pain, you would be given painkillers, but since you're a CKD patient as well, there's a limitation of how much of painkillers you could take. So you will not be able to improvise or change your painkiller medicines. Whatever you do, please run your medication through your nephrologist and then continue taking your painkillers. But it is a part of the journey. You just have to accept it and live with it for a couple of days. The second thing is the sleepless days and sleepless nights. Uh, right after your surgery, the first thing that you will be told is your loved one is not allowed to sleep on his or her side and is asked to sleep only on the back. And like I already mentioned, he or she already has a lot of pain on the upper back, and sleeping only on the back only adds to the stress on the back. So for my case, what I did was I hired a hospital bed, so Sumi was able to sleep in different angles, and it did make a little bit of difference during the recovery. And we also took the issue to a nephrologist, so he was given a few sleeping pills. So he was able to catch up with a little bit of sleep, but still it is not as comfortable as any regular night, not even close to it. So if the patient undergoes so much of sleepless days and nights, you can, as a caregiver, you can definitely expect to undergo a few sleepless hours both in the night and also in the day. The patient will physically need you to be around while he can elevate himself or herself to completely get up from the bed. They cannot put any stress on the wound, so you would need to actually support their back to lift them up. So that's something you might want to keep in mind. You'll also need to be physically around because they will be dependent on you to take a bath, and to do anything they would be dependent on you for the first few days, literally. The next thing that I remembered in my second week was wound care. Since you're already a CKD patient and you're transplanted, you're on immunosuppressant drugs, you want to take care of the wound like a little baby because you do not want to pick up any kind of infections. And for the wound care, the nurses will actually teach you. If they don't, please ask them how to take care of the wound. You'll have to sterilize yourself completely, rip the wound open, clean the wound up, and then put the bandage back. And that was actually not very difficult if you just have to maintain the protocols of cleanliness. So that was another thing. And now coming to eating. No matter what you cooked, he or she may not have an appetite to eat whatever is cooked. So definitely recommend having small meals, nutritious, freshly cooked meals. And you'll also have to keep in mind, since this video is about CKD and an open heart surgery, post surgery, your renal levels are not normal. Your renal levels are actually a little disturbed. For example, your Sumi's creatinine post surgery was 2. In week number 2, it went to 1.8. His potassium initially was a little high. So, in the initial days, he was asked to take a low potassium diet. So, you'll want to find out all that to maintain the appropriate diet for your loved one. But a diet actually improves as you keep moving on. So this was pretty much week number 2. And now I'm going to take you through week number 3 and week number 4. Week number 3 was pretty much the same journey as week number 2. Probably a little better appetite, and the walking is a little more brisk. He or she will be able to walk a little more faster than week number 2. That's something that I definitely noticed. Emotionally and mentally, still very low. Could have fatigue on a few days, but could have a few good days. The good days become more than week number 2. So that's pretty much week number 3. Week number 4 is when I actually began to see a lot more difference. From the physical perspective, especially, you will actually go to meet the doctor on week number 4 for the review, and the wound should have healed by now, and the stitches will be removed, and you don't have to anymore take care of that wound. By week number 4, your renal functions, Sumi's renal functions have come down to pretty much normal. The creatinine was on 1.3, 1.4, which was his base level creatinine, and the potassium, like I already, was already normal by week number 3, and pretty much most of the renal function was normal, and that is definitely a good sign because while you underwent an open heart surgery, you will always have to keep in mind your primary disease is CKD, and so everything that you do to take care of the open heart would be first keeping in mind the kidneys. So but in week number 4, the pain was lesser, but the pain was different. A pain that Sumit had not mentioned in week number 1, 2, 3 started coming up, and the other pains had subsided. Um, like, for example, he started having pain in his right hand, he started having sometimes pain on his right leg, and the back pain still continued to be there. But by the week number 4, the back pain definitely gets lesser because by now the sleeping becomes a little more easier. He was able to sleep flat, and that was my indication to know that he was recovering because till week number 3 it was not very easy for him to sleep flat for a long time. But by week number 4, he was sleeping better, he was eating better for sure, and he had an appetite and started asking for a few food that suits his taste buds. Um, but in week number 4 is when I realized that his mental and emotional stress and trauma had not yet settled completely. So in our case, we decided to seek help for the same because Sumir underwent a few incidents of complete disorientation, which apparently could be normal post a surgery as well. And yeah, and since he's already on immunosuppressant drugs, which kind of gets your mood swings completely out of place, so he was undergoing a lot of mental and emotional stress. So we were given some medicines to help with that, and it did make a lot of difference for sure. There were still a few days that I should mention that he underwent extreme fatigue, extreme low days of energy, and just couldn't move out of the bed. But those days definitely came down much lesser in number. Week number 5 and 6 was obviously much better than the first month. Um, like I mentioned, from the sleeping, he could sleep longer for sure now. He could catch up sleep in the day, a better sleep quality in the night, but not completely normal. Appetite was pretty much back to normal. He was having better meals. Renal functions were completely normal. He was asked to do his renal function test again, and his workouts became better. He was walking 1 hour every day in the evenings, and plus he would do some rehab fitness in the gym in the mornings. He was not allowed to lift weights still. There are a lot of activities he would love to resume, but he was asked not to resume these activities till 8 to 12 weeks. Physically, you have a lot more energy, and definitely your social skills improve by the 5th to 6th week. You feel like stepping out, you feel like meeting new people, you feel like having people over. Not all the days, but definitely uh, a few days at least. Uh, Week number 7 and 8, you pretty much get back to completely normal life, and you can start doing most of your normal activities. Uh, Not driving the car yet, but few activities like that. You are not allowed to lift weights. Um, the, what else were you not supposed to do? Anything too strenuous, definitely a big no-no. Anything that raises your heart rate too high, definitely not allowed. But I do need to mention by week number uh, 7 and 8, um, Sumi definitely had his sexual needs come back, which was a sign that the body is actually getting back to normal routine. Because until then he had no such wants. So that could be an interesting point to take away. So that was pretty much week number 8. Week number 9 onwards, you're doing life pretty much get back to complete normal life. Just a few completely not to do is physically strenuous exercise is the only thing you will be asked not to do. So, well, right now I'm not yet completed 12 weeks. I'm still on week number 10, but Sumir is normal. Sumir is doing his workouts, he's eating normal, he's dancing a little bit, his social life is decent. And when you look at him, seems like he's back with a bang. So, what happens during the course of the last 10 weeks? While you actually see the patient improving his quality of life, I definitely have to mention that the quality of life for the caregiver is not as great as before. But something that you need to know is I think it's okay because I realized that my life was completely on hold for 2.5 months. I couldn't do anything else. At least mentally, everything was around the surgery. Emotionally, everything was around the surgery. Even physically, it was extremely tough. Um, I've honestly, I'm still recovering from the emotional and the mental journey. I'm still recovering from the physical stress my body is gone through. And a few things that I want to talk about, because at the end of the day, this video is for caregivers. Few things that I recommend for you as a caregiver. Please take at least an hour's time out to do what you love. Whether it is you dancing or you singing, for me it was fitness. So I used to run or walk and hit the gym for sure 1 hour every day. That was pretty much my social life. Actually, something I enjoyed doing. Um, your sleep, catch up with sleep whenever you can. Just don't worry if you're sleeping throughout the days. There are days I felt like I just wanted to sleep because I felt like a patient myself. But you're healing as well. So please don't take it for granted that it's okay for you to be around all the time. So just sleep when the patient is sleeping. Um, Talk about your journey, because mentally it is very, very strenuous. If you're seeking professional help, which you might go through, I also felt that at one point of time I went through compassion fatigue, where I was tired of being compassionate, I was tired of taking care. It was a temporary moment, but honestly, I did feel that way. So, if don't cross your limit when you hit that point, talk about it, seek help, and please don't forget to do something like that. And it's easier to say that while you're taking care of your loved one, take care of yourself. But please, it is important to take care of yourself while you put a lot of your life on hold. These important moments of taking care of yourself is very, very important. Well, I hope that this video could have been of some use to you. And if you've been on a similar journey like me, please share it with me, a few points that worked for you. And I would love to learn how you actually dealt with something like this in your life. Well, I'm going to come back with my next video. This is me saying goodbye, God bless you, and God bless you.
Yo.